Dr. Madeleine Scammell is right there. She's assistant professor of environmental health at Boston University School of Public Health and the leader of the Boston University Superfund Research Program Community Engagement Corps. And I was really particularly excited to have Dr. Scammell come be with us for this conference because I think she's developed some very important and great tools for communities to investigate environmental health and health outcomes. So I'm very pleased to welcome Dr. Scammell to be with us today.
Well, I'm really happy to be here. I come from very eastern Massachusetts, a place known as Cape Cod. It looks like this. It's a spit of land. And Boston is right here, and the tip of the cape is here, Provincetown. And it's Cape Cod because it's named after the codfish. And legend has it that the codfish were so plentiful that you could walk from here to here on the backs of the fish. That is sadly not at all true today. You'll be lucky if you catch a single cod going out fishing these days. This has been an amazing day, and it's been amazing to travel with my teacher, my professor, colleague, friend, Dr. Clapp. And as he mentioned, we went down to Seward yesterday, and we stopped at the Exit Glacier. And there's the interpretive signage, that on the trail. And it's got photos of a scientist and some apparatus that's really big and probably collecting important data. And then it says, and I'm paraphrasing, it says, despite all of the advances in technology, basic observation is still the foundation of science. And we started this day by acknowledging everyone on the stage as scientists, and I want us to come back to that. You don't have to have all the letters after your name to make observations that are really essential to human health and the environment. And I actually think most of the research that has been of consequence has been driven by questions asked of people without formal training in science, but with deep knowledge of their communities and the changes they've observed over time. So with that being said, I want to just start a little bit with the story of the fact that your invitation to me being here was the impetus for me to say, okay, I'll go to Alaska, and from Alaska, I'll go to Japan. Because in Japan, in a few days, is the 9th International Conference on PCBs. And it's sort of a funny story about how I got into studying PCBs, which I'm actually doing now. I wasn't doing that a couple of years ago. So I feel like I'm following the ocean currents of PCB as well from Alaska to Japan. But Massachusetts is home to what they say is the largest marine Superfund site in the United States contaminated with PCBs, and that's it, New Bedford Harbor right there. It's 18,000 acres. The sediment underneath the water is all contaminated. And so the 8th International Conference on PCBs was held in Massachusetts. The topic of the conference was PCBs in schools, which was not directly related to the New Bedford Harbor site, but there are many scientists who have, generations of scientists really, who have built their careers on studying the PCBs in these sediments. But I had just co-published a book, co-edited a book with our colleague Charles Levenstein called The Toxic Schoolhouse. And there was a chapter on PCBs in schools in the book. And I'll just say, I didn't bring flyers for the book. And contrary to the culture that is, bragging is not encouraged, bragging is totally required in academia. You are supposed to be self-referential and talk about yourself all the time and all the papers you've written and but I didn't bring the book that I edited, which really wasn't my work, but compiling other people's great work. But schools where we send our most vulnerable populations are so not regulated by government bodies. Not the air, not where they're built, not the drinking water in the schools, not the cleaning products used. They're really overlooked environments where we send our most vulnerable populations, and I mean children, and I mean men and women of childbearing age who work there as well. So I had edited this book on the toxic schoolhouse with a chapter on PCBs in schools. And the organizers of the conference said, "Oh, Madeleine, maybe you could be on our conference planning committee, this international conference on PCBs." And I said, "Sure." And I think they might have regretted that after asking. But they were planning this conference on PCBs in schools and had not engaged any non-scientists. And in Massachusetts, we have a lot of people who are really active in PCBs in schools. Massachusetts Coalition for Occupational Safety and Health, the Massachusetts Teachers Association, the Healthy Schools Network, the Massachusetts Department of Public Health, for example. So we reached out to them. We created a day for the conference that would be geared toward not scientists only, but everyone with a stake in schools, which is pretty much everyone who ever went to a school or who works at a school or has children who may go to school someday. So despite the huge number of people you might expect would go to a conference like that, 30 people came on that day. That didn't go on any other day. But 30 people was 30 people who wouldn't have otherwise gone to hear about PCBs. So that was exciting. And one of the highlight speakers of that day was Jennifer DeNicola, who is a mother, a parent, an activist from California, who has, with many other activist parents and that Dr. Carpenter referenced earlier, filed a lawsuit against the school system. They measured PCBs in the air, in the caulking of the schools, and refused to do further testing and refused to remove the PCBs that were causing the increased air concentrations. So she gave a great talk at this conference, and she posed questions such as, I'm reading, what is the health-based threshold for PCB in the air? Is 50 parts per million protective of a child's health? What is the inhalation threshold for a pregnant teacher? If we do air and dust testing for PCBs, will it produce results we can rely on that are protective of children's and teachers' health? Will these results protect our children's future health? So she posed these questions to a room full of internationally renowned experts on PCBs. And for most of the questions, there were not answers. So then she followed by saying, your research will influence our government agencies and politicians to be more precautionary with our children's future health and will have a direct impact on the health and safety of children in schools across America. None of us want to wake up 10 years from now with a sick child and say, I wish I had been more protective of my child's exposure. So she challenged all of us at this conference to study the more volatile PCBs that are inhaled and not necessarily consumed by eating fish. And I met someone at the conference who lived next to New Bedford Harbor and said, if there's all of this concern about PCBs in schools, what are we breathing if we live next to the harbor? So a few of us got together and said, well, let's find out. So we set up these ambient air monitors, and that's one of them right there. They're really just two salad bowls put together, but inside there's polyurethane foam, which is treated with some chemical substrate that enables the PCBs that just flow through the air at each site to stick to the foam, and then the foam, after 6 weeks, is sent to a lab and analyzed. So it's a different type of monitoring than is being done by the EPA at the site. And we got 19 residents to volunteer to put these monitors on their property. And we've done the first 3 rounds of sampling, and we have not published it, but we have shared it with the residents. Sorry, that's the inside of the passive sampler. And this is a picture of the residents looking at their data. Every single person who volunteered, who wanted to, came and looked at it. And you know, I actually, I'm not showing you pictures of all the residents because they don't want their identities to be known. But, and I really actually don't care if you can see the data itself, because the point here is not about the data, but about the process that we went through to communicate the data so that the residents owned it, that they really understood what they were looking at. We didn't show them at first any fancy graphs or trends or patterns. We asked them instead, what do you see? What are your questions? There are 209 PCB congeners. We showed them the concentrations for all 209. And they had a lot of questions. So we wrote the questions on stickies, and we posted them around the room. And then we went through, we organized the questions into realms of questions and talked through them. A lot of the questions we didn't have the answers to at that time, so we had a follow-up workshop where we had prepared some answers. Some of the questions were really hard. Some of them were like, what does nanogram per meter mean? Or what does meter cubed mean, which is how you measure air. So this exercise is actually described on a website called Statistics for Action, which is on your handout, the link to the Statistics for Action website. And that was, all the resources on that website were developed over several years by a number of different organizations to think about when communities, non-scientists, get test results that are numeric values, how do they make meaning of them? What's some information that would be useful for them to understand these results? Because that is really important for being able to advocate for your results. So this is just another slide from that night, or actually from the follow-up night. Okay. So that project, I just want to acknowledge all of the other organizations, Hands Across the River Coalition, Alternatives for Community and Environment, Toxics Action Center, and the Iowa Superfund Research Program have all been involved with this study. So the handout that I hope all of you have by now, you don't think there were enough? Oh. I think, okay, we can pass them down to that side. That would be great. So sorry, the end of that story is that I'm going to Japan to present on what we did. And it's not on the science of the PCBs, it's not on the concentrations we found, it's on how we communicated what we did and how we engaged residents living next to the waste site in this whole process of thinking about the health risks of PCBs. And I'll just say, they're asking really tough questions because the concentrations they're exposed to, the congeners of PCBs they're exposed to, are not the ones for which we have a lot of health data, because, as Dr. Carpenter said, we've been so focused on the exposure route through food of the heavier weight PCBs. So their questions are driving a new realm of research, I would say. So the handout is organized into sort of sections about planning a study, doing a study, and then understanding the results of the study and communicating it. And that's partly because I'm, like many of you, I think, a huge proponent of participatory research, so that those most affected by the results be involved in the study from the very beginning, designing it, carrying out the data collection, and interpreting the results and doing something with them. So there are times in that process where, as a scientist at a university, I may be more involved or less involved with every one of those steps. But I tried to organize the handout in that way. On the second side is just a whole bunch of resources that may be useful. But most of the stuff I want to talk about that's just one link on the handout is this health studies guide that I and many colleagues have worked on for an embarrassingly long time. You'd think that we were solving all of the problems in the world by how long it's taken us to write this guide. But Sylvia Brody with Toxics Action Center and I have presented on this in several different settings, so I've borrowed from slides we created together. So this is what the website looks like, and this is the cover of the guide to give you a sense. Dick Clapp is listed there. The Center for Environment, Health, and Justice is one of the sponsoring organizations, along with the Center, the Science and Environmental Health Network, and many people have contributed. So why we started working on this guide is that in the early 2000s, there were a lot of calls being made to the State Department of Public Health requesting a health study. And an investigative journalist for the Boston Globe actually published an article, and we got access to these data from the State Department of Public Health. It's an average of 1,400 calls a year to the state requesting a health study because there's an exposure of concern or a disease cluster, and they want to know what's going on. And there are, at the time, I think there were 3 people working in the Bureau of Environmental Health Investigations. They did not have the capacity to respond to all of these questions. And the wait list was years that sometimes people would wait to even hear that their study was being pursued. I mean, like 4 or 5 years. And then it would be another 5 years, if you're lucky, before any study had been completed. So there is a huge burden on the public health infrastructure for disease investigations, and organizations like Greater Boston Physicians for Social Responsibility and Toxics Action Center and BU School of Public Health faculty were getting calls, and similarly trying to figure out a more systematic way to assist community groups without putting them off and saying, well, it's really complicated. Because that is often what people say, and that's true, but there's got to be more to it. Additionally, a lot of studies, when they are done, are inconclusive. And this report came out in 1992. It summarizes the title, anyway, how a lot of people feel about health studies, that they're inconclusive by design, that they're not going to find anything. So is it worth your investment of time? So the health studies guide is in itself a cautionary tale. The first couple of chapters are really to help a community group and help researchers and public health officials and anybody in the position of having to respond to a request for an investigation think through together, is this the right approach? Do we really need a study right now? Should we use our time and resources to take a different tactic? If we know we want to shut down a polluting industry, do we really need another study, or should we do direct action, just for example? So where's Sama? This is Giovanna Garcia Soto, who is a mutual friend of Sama and mine. She was a community organizer in the city of Chelsea, where I live, and she brought youth from Chelsea to BU School of Public Health to learn how to do particulate matter monitoring. And that's just one of the ways that we've worked with our local communities to assist them with questions about like air pollution. But I just had to put that picture of Giovanna here. Hi, Giovanna. I've learned most of what I know about organizing and policy and how to make our results useful for change from Giovanna and her colleagues. So sorry, that was a little deviation. The Health Studies Guide. First, in the cautionary tales, we talk about the fact that Very few relationships are widely believed to be true between, say, an exposure and a health outcome. And that these examples in this table are based on hundreds of studies over many, many years. And so to be cautious in setting hopes and expectations for how earth-shifting a single health study is going to be. We also describe an exercise for why do people want a health study, and this is something that people can do in their living room, just talking through why a health study and parsing out the responses. If action is the primary reason for wanting a health study, maybe a health study isn't the way to go. If you have a real question that you want an answer to, then a health study might be the way to go. But health studies are designed to answer questions, and you can't control the results of those. You can't control the answer. It might work for you, and it might work against you. So I'm just walking through. I failed the class on how to do effective PowerPoints. I didn't show my outline, and I apologize for that. But I think you could just, go along for the ride. This is just part of the guide. Thinking about the motives for your study. I'm going to cruise through this a little bit. So you can look at the health studies guide on your own. But more positive and negative things a health study could do. It could document disease and exposure, or it could document no significant relationship between disease and exposure, and that could be used against you by polluters to continue with business as usual. So do you really want more evidence that could harm your goal, your cause? And then there are a number of other sort of cautionary tales. And this is all written in the interest of supporting people when they do decide to move forward with a health study. But again, setting hopes and expectations. As David Osnoff has said, he's already been mentioned once today, no matter how good a study may be, someone will have something bad to say about it. And if it is a flawed study but people are organized, it could move mountains. So some people have interpreted this in not quite the way I intended, that you can move mountains with a bad study. But what I really hoped to impart is that it's really important to be organized, which is, again, why people like Giovanna are really important. And ACAT, to work with groups that are going to be prepared to deal with the negative responses to even the best study, especially when you have an industry that's responsible for the outcomes and they have a lot of power to refute your findings no matter what they are. So this is another story from the guide, which you can read. And a worksheet that helps people walk through some key questions as a group. And then a menu of health studies. So, you might be thinking about a cancer cluster investigation, but there are so many creative ways to think about studying environmental health. So we start with mapping exposures, mapping disease. Maybe that's enough to make your point, to find out where the cases of disease are, so you can do something about that. And then there's different types of exposure assessment. We've heard a little bit about biomonitoring for chemicals in people's body fluids, but personal monitoring the environment around you. We have a piece on environmental impact statements, because rarely are they requested by communities, but they're also given to communities as part of permitting and regulatory processes. So we included environmental impact statements in there. But then surveys, door-to-door surveys, analyses of registry data, so vital statistics, cancer statistics, and causes of death. And then we have the traditional epidemiologic studies on the bottom that study the relationship between exposures and diseases. So this is just meant to give you a taste of what the Health Studies Guide looks like. It's illustrated by Mei Wu, who's a really talented environmental health scientist artist. And we give examples of the types of questions that would drive different investigations. So one of the things, every question is different. And this happens to students, but it also happens to communities. You think you are really clear about the question you wanted answered, and you got a study that answered a different question. So there's a lot of nuance in how questions are asked, and you got to be really careful about how you express those desires, those questions, because I'm actually going to quote Dave Ozanoff on this. He says, you go to the doctor because you have a broken wrist. And the doctor says, I don't know anything about broken bones, but I can examine your colon. And so you get a rectal exam as a result when you really had a broken wrist. And he said, we've been giving communities colorectal exams for a long time. And we're doing what we know how to do. It's not often what we've been asked to do as environmental health scientists. So drive the question, drive the studies if you're in a position to ask for it. So we have 7 chapters. The first 4 are done, and they've been translated into Spanish. We have 1 left to translate into Spanish and 2 left to finish. These are the ones still to come, how to evaluate the results of a health study. And that's more like if you're reading a health study, you can understand the p-values and the way that's interpreted, the sources of bias, things that are likely to be used against a study that you might conduct in the future. So, and then chapter 7, I just love this visual by May. If you have your study question really clearly framed, you know exactly what you want to do, where do you go for help with all of these sea of acronyms of different agencies that assist community groups? We heard from a few of them today, EPA and NIEHS, there's CDC, there's the Departments of Health. So we go into a little depth about what each of them does and how they interface with communities through funding programs, through regulatory programs. How can you access those agencies that are meant to protect public health? And then some cautions about having your questions co-opted, some cautions about working with experts, and some great stories of how that's been done successfully and worked out for the education and empowerment of all. So these are acknowledgements for the Health Studies Guide. In particular, Greg Howard, we were office mates in graduate school, and clearly a relationship that's lasted forever. As long as we work on this guide, we'll be friends, but we're not office mates anymore. Okay, so that's the Health Studies Guide. There are some things that are not in the guide that I just wanted to talk about in terms of tools for environmental health investigations. So one of those things is about narrative and qualitative research, our stories. This is particularly relevant in small areas. And I've seen it be used, I've seen the data from stories be used by epidemiologists. And so you don't often read about them in the scientific literature, how that data was collected that resulted in this study. But I think sharing our stories and our narratives is really essential to forming questions and is itself its own data that social scientists have used for ages. So that is not yet in the guide, but really important. The tools that we do describe, risk assessment, epidemiology, exposure assessment, toxicology, really, those are awesome. I mean, I'm using them all the time. but they're relatively blunt tools, and we need to expand our toolkit to think about other disciplines and areas that we can expand our toolkit, essentially. The other thing that is not in the toolkit is probably the most important tool of all, and that I hope we promote by the Health Studies Guide, is solidarity, is working with other communities that are not your own, working with other scientists. So a couple of hopeful stories. Maureen mentioned Tender, which is great. I recently discovered another similar network called the International Society for Children's Health and the Environment, and ISHI, as it's known, is comprised of scientists from a variety of disciplines: toxicology, epidemiology, clinicians, environmentalists, students, public health officials. And it's rooted in the premise that action to prevent harm to children from environmental hazards lags behind the scientific evidence. And these are scientists, many of them have been studying environmental health for decades and are frankly frustrated that their science hasn't resulted in more protective action. So part of ISHI is trying to establish relationships with non-governmental organizations, advocacy organizations, groups that are focused on change at the policy level, on the ground. And so those scientists have an opportunity to intern with those organizations to learn about how their science could be relevant to the problems they're working on in the field, to the legislators who don't know about particulate matter and really should. How do we get that information into the hands of people who are making these decisions? So I think there's a lot of hope among scientists today that if we connect more with organizations who are actually making change, making the environment and human health better, and have less fear about speaking out about the meaning of their studies, that's a good thing. And then, you know, I could say a lot more, but I just wanted to say, you know, we have, I think a lot of people in this room may know Steve Wing. He's an epidemiologist at UNC Chapel Hill, a good friend, and Patrice Sutton at UCSF, Program on Reproductive Health and the Environment. And years ago, I don't know where we were when we had this conversation, but we wanted to make a summit of poisoned communities. And we knew poisoned communities was probably not a politically correct term to use, but communities that have suffered from military exposure, from nuclear waste, from Superfund sites, from any number of hazards. And our friend Rebecca Altman is studying communities exposed to perfluorinated compounds, the same family of chemicals in 6 different places around the country. If all of those communities could come to one place and share their stories and work together to come up with solutions for these exposures, that was our dream, that was our vision. And so I just got to say thank you, ACAT, for bringing us here together today to nurture that network of solidarity and action. And I've had a great time, and it's really hot up here. Thank you.